Hello, everyone, and happy Wednesday. We welcome you all here to another Illuma webinar. Today, we have the privilege of hearing from Dr. Peter Faustino, a school psychologist, and he's going to talk to us about autism. The name of his presentation is, you can see, is Autism and Mental Health, Comorbid Crossroads. And before we jump into Dr. Faustino's presentation, just wanted to walk you through our agenda. Could we look at the next slide real briefly? I'm going to take as little time as I can to talk about the presentation, so we can reserve most of it for the presentation, but also need to acknowledge the presence of Dr. John Kelly, who is going to be moderating most of this webinar. But before we jump to any of that, just wanted to give you a little background. If you've never been to any of our webinars before, wanted to just tell you a little bit about who we are. We are Illuma. Could we take a look at the next slide? We do teletherapy, online school psych, mental health assessment, to provide these services to schools and districts all over the country. We were founded over 10 years ago and are working across 36 states. We've served 27,000 students today. And one of the things that we'd love to do is to give more information and share expert testimonials, expert research from the likes of Dr. Kelly, Dr. Faustino. So with our webinars, we like to invite these kinds of distinguished guests that can share with our audience, both clinicians and administrators across the country, so we can learn a lot more and we can always do better at what we do. I would encourage each and every one of you to follow us on Twitter and Facebook. The links are there. But I don't want to take any more time. I'm going to turn it over to Dr. Kelly and Dr. Faustino. Dr. Kelly, why don't you run with it from here?
Excellent, George. Thank you so much. Pete, if you could put the next slide up. Let me first by giving a shout out to Illuma and a big thank you for hosting this series for us. The platform has been absolutely amazing and wonderful. This is a series of webinars that we're putting on to really talk about creating better mental health and wellness within our schools. I was privileged enough to kick off the series a couple weeks back. We had Dr. Eric Rosson join us last week, and I'm absolutely thrilled. I mean thrilled to hear my friend and colleague, Dr. Peter Faustino. Just next week, we're going to hear from Ben Fernandez, Dr. Ben Fernandez, and then we'll finish up this series with Dr. Todd Savage, another good friend of ours here. So let me tell you just real briefly about Peter. I'm not going to read his bio. He's a good-looking man. I mean, look at that picture. It's absolutely incredible. But in all seriousness, Pete is the ultimate professional. He's a school psychologist within New York, but he really has this expertise within the area of autism. He has worked with some of the national organizations. I'm sure he'll tell you more about the national organizations. But what I really admire about Peter and Peter's work is that he brings it down to the practitioner level. So whether you be a school psychologist, a social worker, an educator in the classroom, an administrator, Peter brings it down to that level where it makes the information very accessible. It makes it usable for us within the schools. I have been privileged to work with Peter on a number of different projects over the years. And again, I'm thrilled to hear my good friend, Peter Faustino, speak with us tonight. So Dr. Peter Faustino, please take it over.
Boy, you guys are showering me with praise. I appreciate it. I really do. And you know, George said distinguished. I'm not sure if I've been called distinguished before, but I like the sound of it. Today, I was talking to a colleague who referred to himself as a high performance psychologist. And I thought, ooh, I kind of like that term, high performance. So I may be playing around with that a little bit. But one of the things I want to do is just let you know that I have condensed probably way too much information into a 1 hour, 45 minute with Q&A presentation. So I am going to jump in and just sort of go through as much as I can. One of the things I do when I present, I create a PowerPoint that is hyperlinked. So almost every image, many of the slides, if not all of them, are hyperlinked for more information so that you, the attendee, can listen today, get a flavor for what we're talking about. As John said, I'm hoping to make it a little bit more practical. I am a practitioner, school-based school psychologist, but the hyperlinks are for you to go back and explore and go on your own journey, with regards to autism and mental health, which is just a huge conversation in mainstream right now. And I am really excited because most of the content today actually has been taken from research or reports that have come out within the last year, 2 years. And so this is a pretty current and curated presentation. A couple quick learning objectives and maybe some fun for you guys to put in the chat box, which I would encourage you to use. The first one is I'm hoping that you get a lot of new to you resources and ideally free resources so that the professional development you take away just kind of is easy to access. If that's the case, put in the chat box. Ooh, that's new to me, because I would really welcome knowing what's out there, what's not out there, as I continue to kind of share this information. The second one is I want to really begin to have a conversation about turning disability into diversity. I think this is really the future of conversations around much of what we do in psychology, but in particular autism, which I'm quite passionate about. And then the third goal, which I'm hoping for, is really to create a kinder, diverse, more inclusive world. And I think the way we're going to be able to do that, honestly, is in this virtual format, is if you put comments in the chat box about experiences that you've had, share what you know, comment on the things that resonate with you. Disclosure, I'm not selling anything. I don't have a book. I don't have a website. I am a practitioner. I am really, really passionate about this work, and I am happy to present that to all of you. If I did have a role to disclose, it would really be as a volunteer for some really wonderful national organizations, which I'm going to share most of that with you. I am being reimbursed for my time, but short of that, it's really about me listening to families and loving the work I do and just trying to share that with all of you. Because I am a fan of social media, I have 3 teenage daughters, and sometimes I think I might be on social media more than they are. It dawned on me that the way to extend the professional development that we do is, as you heard, Illuma Therapy is on Twitter. I know we follow each other. They put out a lot of great content. But if you want to either follow me on Twitter, or more importantly, when you go to the search bar, type in autism actions. And there's an example of it there, because I discovered that nobody is using that hashtag. So when you click on it, I suspect you're only going to see information that I have tweeted out that is relevant to autism. So if you're a fan of Twitter or social media, type in autism actions, and you can kind of just go ahead and find more information, sort of follow up for you. Sometimes when you're in the field for long enough and you're doing work in a particular area, people will throw around the term expert. And I think it's a term that sometimes I get still a little uncomfortable with until I saw this quote, that an expert is a person who has made all the mistakes which can be made in a very narrow field. And I thought, that speaks to me. I think by that definition, not only am I an expert, but I suspect those of you that are on here for a particular reason, because you know someone with autism, you educate or work with someone with autism, you want to learn more, you love someone with autism, that you too are experts out there as well. And so same caveat that I gave before, put that information in the chat. I want to know about it. But I do like to share a little bit about my first experience with autism. I was fresh out of graduate school, probably the first week on the job, and there was a young lady in the middle school who, when she got upset, would run from the classroom and climb a tree that was in the very front of our school building. Well, that certainly got the attention of the executives, the administrators, the principal, pretty much the teachers. Everybody knew about this young lady that was climbing the tree in the front of the school when she got upset. And I, as a young school psychologist, was trying to figure out, how to help the situation. Well, on one of those more desperate days, I made a comment to the principal that if he cut all the lower branches of the tree, it would make it really difficult for this young lady to climb the tree and be in harm's way. Well, that night, the custodians came out, they cut all the branches on the lower part of the tree. The next day, this young lady ran out when she was upset. She saw that she was unable to climb the tree, and I proposed that she come to my office so that we might be able to begin working on different ways of handling her emotions. And it worked. So not sure if that qualifies me an expert or just someone who got lucky that day, but I certainly have lots of experiences where we are working on, strategies that work. The presentation has a lot about intervention. So I wanted to just put a quick note that we're not here today to talk about diagnosis of autism. Tends to be one of the bigger categories working in schools. Everybody wants to know, yes, autistic, no, do you think it's autism? This question comes up, constantly. That could be an entirely different presentation. But as I said, new current information, I do want you to know that as of just a month ago, the FDA approved Linus Biotech to receive this sort of breakthrough device designation. And essentially what it is an experimental test. So again, experimental, you can't tell your families to run out and request this test yet, but they are looking at, and it's called Strand X ASD or Strand Diagnosis ASD, but it's essentially designed to detect molecular biomarkers that we know correlate to autism. Right now, the earliest we can do with diagnosis quite often is observing behaviors that are somewhere around 18 months or 21 years, if we are fortunate, if you're in a community that has really good resources. But I think in the near future, we are going to be looking at essentially like a hair sample, a strand of hair that might give us information, biomarkers, reliable enough to help us design, early interventions prior to 18 months or 21 years. That's pretty remarkable science that's going on in this field of autism. If we're not going to talk about diagnosis, what we are here to talk about is how to elevate your perspective of autism. And I think this is some of the passionate work that I've been involved in over the last 20 years of my career. One of the more famous role models, representatives of what is called sort of the neurodivergent community is Temple Grandin. We're actually attending a presentation in a couple of weeks where Temple Grandin will be the keynote speaker, and I'm excited to hear her speak again. I think she was actually just quoted or perhaps did an op-ed in the New York Times just a few days ago, which I wasn't able to hyperlink in here. The hyperlink on this image is actually to her website where you'll get a ton of information. But she really is, I think, one of the early individuals who was able to articulate what it was like to have an autistic brain, to see the world, not from a neurotypical standpoint, but from this neurodiverse standpoint. And what I would say is that while, reading the materials and the books that are out there or speaking to individuals who self-identify and can share a lot, you can also learn a tremendous amount from the students or the clients or the families that you're working with. You're going to hear me say that a lot today. And that image on the right side, if we were in a room, I would ask the question, actually, I guess I can still do this, right? I'm going to ask a question to say, does anybody know what that image is? And I can't quite see the chat, but put in there if you know what that image is. I'll give it 1 second and then tell you that that image was a student who was requested by the teacher to write the alphabet. The teacher's intention was, I want you to write the letters of the alphabet, A, B, C, D, in some sort of linear fashion so that they could go back and begin to fill in. A stands for this, B stands for this, sort of like a mnemonic device. Well, this young man, the way he saw the alphabet and the world was through this image. And I think if you had time, you could go through, I've done this numerous times, you would actually be able to go through and see that all the letters of the alphabet are represented in that image. To me, that was one of the more powerful moments where I realized individuals, students with autism that we work with, see the world in a very different, interesting, complex way. And I think whenever we begin talking about autism as a neurotypical individual, we see it like the top part of this image, which is that autism spectrum, is linear. I think the word spectrum, gives us this idea that it's like, one side of the spectrum, the other side of the spectrum. But there's a lot of great visuals out there by individuals on, with autism who are helping us understand that autism spectrum looks, very different, probably more like those two little, pie graphs like that with hash marks inside, that one part of the pie could be looked at as social differences, and that changes in every individual, maybe even on the particular day, or that their interests, are different at different degrees. The degree of their repetition of behavior, sensory sensitivities, emotional regulations. I like looking at a circle because I think it starts to help us really understand, I think, that it's not linear, that it's much more complex. And certainly when we try to lump individuals into, discrete categories about high functioning, low functioning, Asperger's, I don't know if I would say that it's all harmful and outdated, but certainly there's other ways of conceptualizing this. But for today, the purpose of what I want to focus on and maybe help, share this journey is that other category. If you look at this slide, right, there's that little box at the bottom that says other. Well, the interesting thing based on, where we are today is that other really is the concept of mental health, or at least that's the one I would like to talk to you about. And so there's some research that I've hyperlinked to back in January 2020, which right now, if you think about where you were, January 2020 was just prior to the start of the pandemic. Seems like, a completely different time in our lives. But the research prior to the pandemic around autism was really highlighting that mental health was at a crisis level for families and individuals with autism. And you'll see here that, overall, 32% of parents, right, at that time were reporting that their child had experienced a mental health crisis, not a mental health challenge or an issue or a symptom, but rather a crisis. And if you think about what we knew prior to the pandemic around mental health, sometimes the numbers were around 1 in 5, 20%. So by connection to the diagnosis of autism, right, I mean, these families are struggling at a greater rate with mental health. And when you look a little bit deeper on here, right, in many of these groups, elopement or running away, self-injury were reported at the most frequent levels, physical and verbal aggression. I mean, these things are at a really high level. And then if you look where the correlations exist, right, around increased parental depressive symptoms and lower family quality of life, you realize that it's not just the individual, it's not just the school, but it's the entire system, right? The entire family that's really being impacted by this. So as a practitioner, as a clinician, you see that approximately 75% of those individuals in crisis had seen a psychiatrist, a behavioral therapist, a psychologist, probably reached out to individuals to engage in mental health treatment. And unfortunately, 25% were not engaged in any mental health treatment. So there's sort of a tale on both sides of that. But the idea that mental health and autism were connected was a pre-pandemic conversation that was really bubbling up to the surface. Now, in that hyperlink to that research study, I came across something that I haven't seen in a while. I couldn't find the easiest hyperlink, although it's in there for you. And certainly George and Iluma can share some of not only the PowerPoint that is hyperlinked, but I'm going to share with you guys perhaps this assessment scale because it is free to the public. And don't forget, if this is new, type in new, I want to know. The mental health crisis assessment scale. And I don't have I should have put the last page in here as well, because it's about 3 or 4 pages for you. And you can see some of the behaviors and examples of behaviors, and then the rating that the parents would do. But on the last page, it essentially says, add up the numbers, and then let's talk about what the intervention is going to look like. I think what I'm excited about when I see a lot of these forms that are new to me, right, and hopefully new to you, these forms really begin to guide us towards interventions. And I think this is one of the few forms that I've been able to find, which is mental health crisis and autism. there's probably, or I know there are, lots of other rating scales that are out there, but what we're really in need of are forms that are tailored to autism. And so I think, again, you'll get the link for all of this. You might even be able to Google it and find it. It was a little tricky to find, but these types of forms are really the resources I want you as attendees to have access to, such that you can begin using that in your own practice. Autism, the prevalence, continues to grow. I know that when I started in the field, there were, numbers around 1 in 120 or 1 in 300, I think were the numbers. And then as you start to pay attention to when the CDC was beginning to collect this information, you watch that number go down, right, to 1 in 64, to 1 in 54, 1 in now 44 is the prevailing ratio of the number of children that are being diagnosed with autism. I think the interesting finding from that CDC report, which came out really just a year ago, was that about half of those individuals were either intellectually disabled or classified in the borderline range. So sometimes we are talking about the higher end of autism because students can be, for lack of a better word, quirky, and they're in classrooms. But when we talk about autism, we really have to look at, I think, the full range of students that we are going to be working with in the future. If 1 in 44, I mean, I know it's an accurate diagnosis or the idea of the prevalence. And, you can kind of even see Allison Singer, co-founder and president of the Autism Science Foundation. I liked her quote, right, about the information makes it clear that we're getting better at diagnosis and identifying earlier, which is encouraging because the research has consistently showed the value of early intervention, but that we really have to begin thinking about the full range of individuals with autism, and it warrants more attention from policymakers, service providers, and because I think it's dramatically different sometimes than those milder forms of autism. So these are the individuals, when we use the term autism, these are the individuals that we're going to be working with in the very near future, if you're not already, and maybe that's what brings you here today. It's been an exciting year. I know I'm kind of jazzed up because, as I mentioned earlier, there's a lot of new and current information in this presentation, but a report to Congress from a federal interagency work group in 2021, which it is hyperlinked in there. That report to Congress is a little bit more dense, so I tried to pull out a couple of the highlights, but what you can see is we need improved screening and diagnostic tools. We need optimized behavioral and other therapeutic interventions. We've really got to talk about primary, preventative, emergency care systems when we were talking about the mental health crisis that so many families are involved in. But the theme that is emerging that I'm going to repeat multiple times tonight is this idea of better treatment for co-occurring conditions. And so you'll start to see, I think, that pop up, as well as, this idea of the mental health of the caregivers for so many of the people that are doing this. Now, if that report to Congress didn't contain enough information about mental health and the concerns and questions, one that stumped me, or not stumped, but really, I think surprised me is the word I should be using, is that as I was talking to colleagues, somewhere around this April 2021, it was from the International Society for Autism Research around the idea that suicide risk is actually higher in individuals with autism. I have done a fair amount of work over my years of practice in suicide prevention, suicide awareness, suicide assessment. And I was unaware that the research was being collected around a hidden crisis, something that we were really overlooking. I think whenever I hear something like this, it immediately changes my practice, such that if I was working with an individual with autism, I would be thinking about certain things like their anxiety or behavioral interventions. But now I am beginning to include the questions around suicide, knowing that they may be at a greater risk. If you see the studies out of the US, Sweden, Taiwan, you'll see that autistic people are up to 7 times more likely to die by suicide and 6 times more likely to attempt suicide than the general population. And then even worse, I think, if you look at the greater risk that autistic women are 13 times more likely to die by suicide. And while I can't take the time to delve into the possible, causes, the idea that, we know about gender differences, we know about masking quite often in females with autism. We know quite often about the later diagnosis that comes with females and autism. I wonder if that is a contributing factor to some of this increased risk. But hyperlink to that information, be mindful in the work that you are doing, and I think you are going to start hearing about this more frequently, that suicide is a concern among individuals on the spectrum. And so from that research study, actually, they put quite a few priority recommendations that you can see here. What can we do right now? I mean, hopefully all of us are having conversations. I know it's quite frequent in the world that I live in around the idea of removing barriers to mental health services. Actually, sidebar, George and I and John Kelly were just talking about, before we started the recording, about removing barriers to mental health services and what a priority that needs to be, and what Illuma is doing, I think, to do their part in that area. Today, I'm telling you that some of the world's leading scientists in the area of autism are asking that same very question, setting it as a priority recommendation. The idea that we need to know this information, that we need clinical partnerships. I do a ton of advocacy work. We've got to talk about passing legislation around these areas. But also developing guidelines and new ways to access this. At that last bullet, you're going to see the little note about personalized support and treatment. That is something that is becoming more and more popular in the conversations that we're having around autism. And if that wasn't enough new information to digest prior to everything I had just said, the Lancet Commission put together some of the greatest minds in the area of autism. And they created a report, a really comprehensive report. It's like the mother lode, the best and the brightest got together. And really, what I like to say about this Lancet Commission report is, if you want to know the future of autism, it's within this report. It's a roadmap for us. And some of the highlights from that, which I'll reference throughout, is that awareness of autism has grown monumentally. We're doing an outstanding job over the past 20 years of having that conversation about increased awareness. What we haven't done yet is, it hasn't been accompanied by improvements in services for autistic individuals and their families. Many of the fundamental questions still remain about which interventions are the most effective, for whom, at what moment, and at what intensity. And I think when I reference personalized treatment, and I'm going to say it a couple more times, it really can get summarized in that notion of which intervention, for whom, when, and at what intensity. The moment we begin answering those questions, I think we really start to increase the outcomes that we've got. But the Lancet Commission really is looking at future care, clinical research, and they want to not, talk about 20 more years. They want to talk about the next 5 years of what families need worldwide. The response to that, and in that Lancet report from December of 2021, which was just a month ago, right, 2 months ago, is that autism rarely travels alone, and that detangling and treating these co-occurring or comorbid conditions as early as possible is very, very important to helping children and families realize a better quality of life. The hyperlinks that I can't go through, one is the Autism Care Network, and this is essentially an outgrowth of Autism Speaks and a bunch of other partners who essentially said, hey, Lancet Commission recommended some really amazing things, especially these partnerships, and a warehouse of where we can get information. Let's do it. Let's put up a website and get people connected. So when you click on that, you're actually going to see opportunities for professionals, for families, a section for research on some of these things, because I don't think people really want to rest on the idea of this is this really great report and we're just going to read it and then file it away somewhere. But again, I think you're hearing those themes, right? Co-occurring conditions, comorbid conditions, the title of my presentation. So it dawned on me to say, well, what are we talking about when we use that term? I mean, I think many of you have probably heard the term comorbid or co-occurring, but what does it really mean? I found this great link from just a little while ago, from a couple of years ago, that I think sort of gives us the characteristics. But I think the important thing that I wanted to highlight for you was the idea that too often I'm having conversations with schools, with practitioners, less with families, but more with people who are beginning to understand the work around autism, and they will use the term autism as if it's a catch-all, as if it's if it includes all the conditions that go on, and we're just going to lump it under the same disorder. And I think that's the cautionary tale. I think that's essentially what I'm here to say, is that we cannot do that. That in fact, whether we call it comorbid or co-occurring, that there are two or more independent conditions that are present in the same individual at the same time. Today's conversation literally was a student who was not participating in any of his classes. The teachers, the team were getting frustrated because participation is so important in a classroom. And this student is bright, brilliant, dare I say, but not participating in the classroom. And the phrase of, well, you know, he has autism, so maybe let's just give him a pass on some of this, or somehow that explains why he is not participating in the classroom, did not sit well with me. And I think it is an example of what I'm talking about, this comorbid crossroad. So the way the conversation shifted was for me to say, well, let's assume that the autism doesn't have a lot to do with this particular problem. What if he's anxious? What if it's some sort of, you know, language concern? What if it's something else that might explain the barrier to the behavior? By thinking about the comorbid or co-occurring condition, instead of lumping it into autism, we now begin to formulate solutions. We now begin to think, how are we going to treat this individual? And I think that is a shift in our thinking around autism and working with individuals with autism. This was a really great visual that I had found on, you know, here are the core autism spectrum symptoms, but look at all the comorbid conditions that we could consider, and not just use the term autistic or autism or individual on the spectrum. Let's have a conversation about, here's anxiety. How does anxiety relate to, say, their social interactions? Let's talk about hyperactivity being part of their social reciprocity. Let's talk about aggression and their, you know, repetitive behaviors or sensory abnormalities related to a language impairment. Because the moment we start talking about some of those comorbid conditions, I really do believe that we're going to be led to a greater number of interventions that we can use in working with individuals on the spectrum. And you know, I feel like I've had this conversation where I say, hey, let's talk about comorbid conditions. Let's talk about something else. And people are like, yeah, no, I get it. That's not such a big deal. Well, on January 18th, and this may not be the greatest example, but I think it highlights the idea that sometimes as professionals, we want to just focus on one thing, or that we use a term and we think that it will signify a lot more. But the CDC director had to apologize for hurtful comments related to COVID by saying the overwhelming number of deaths, over 75%, occurred after the vaccines in people who had at least 4 comorbidities. And her quote was, so really, these are people who were unwell to begin with, almost acknowledging like, well, we can't really do anything about the comorbidities. We're really just focused on one particular area. And I don't mean to highlight something that someone said and you know, made a mistake with, but I thought it was such a timely connection to this presentation around the idea that comorbidities are real and have to be a part of the conversation. We cannot look at a linear, singular term like autism and just say, okay, here we go, right? So part of the work I love doing with teens is just listening to them, writing down sometimes their quotes without, unfortunately, they don't get the credit for confidentiality reasons. But if we start to shift with, okay, Dr. Pete, I got all the information that you guys are, that you're helping me understand around autism, these comorbid issues, right? Mental health. Where should we begin, right? This teen said to me, I don't know where to start, but I also don't particularly care. And I thought, well, maybe that's the best way to do this next part of the presentation is just roll up our sleeves and jump in. Humorously, this quote wasn't about my presentation, but actually was about his desire for a girlfriend. And so he had said, I'm ready for a girlfriend, Dr. Pete. I said, okay, terrific, as if somehow it was going to happen that day. And I think I said to him, well, where should we start? And he said, I don't know where to start, but I also don't particularly care. And I thought that was too funny to pass up. The shift we're going to make. So if those were some new resources and you're going to get a ton more coming up, right? The idea that I wanted to share with you is that a lot of autism should be conceptualized as a transactional condition. The idea that everything an individual with autism does is going to shape and shift their treatment. So sometimes I think we do think about, a particular approach or a particular manual or a particular time set of something that we're supposed to do. But what I want you to begin thinking about is a much grander, broader picture of this idea of nature and nurture, teaching skills, but also the environment that it lives in. I have the good fortune of being friends with Dr. Catherine Lord, who was here in New York, really close to where I live, at the Center for Autism and the Developing Brain. And while she was there, one of the things that I remember us talking about, and this is a quote from her, is that there is this constant tension because there's a lack of interest in the actual experiences of families and autistic people, that sometimes we think of the term, we look for a manual, we look for a treatment, and that we're not giving enough interest to the actual experiences of the individual or of the family. And that is where the future, I think, of our intervention lies, right? Autism is not only or is not who you are, it's also what's happening to you. It's the environment, it's the community that we are in. And sometimes I can say it and you'll hear it, but I think one of the more famous researchers in the area of autism is Dr. Ami Klin, who used to be at Yale University, is now down in Georgia at the Marcus Center for Autism. But I'm going to give just a minute for him to share.
Behavior is under tight genetic control. But autism is a transactional condition. There is genes and there is the environment. What is the environment? Caregivers and peers. And so our approach has been to create early forms of treatment that, one, are going to reach the level of intensity, because if you're having thousands of deviations from normative socialization every day, you need great intensity. How can we achieve that? I'm now in the South as well, and what we know is that we have 1 hour of early intervention a week if the child is identified. So the process has been to actually train parents. Using a parent-mediated treatment, using everyday activities, we can actually engineer the environment where they are. Now, why do we feel that this is important? Because we need to create community viable solutions. We need to have treatments for which people will have access to, and this is a collaboration with Amy Weatherby from Florida State University. We have web-based, video-based systems to train parents and all. And what we found out is that those concepts of early brain development really have much broader application than in autism, because with poor kids, with kids from disadvantaged backgrounds, those kids are also missing opportunities for learning. They are basically being exposed to 30 million words less than their middle-class counterparts by the age of 3. And the former CDC director, Dr. Brenda Fitzgerald, has called those forms of treatment probably our very best vaccine against poverty. And this has now become a public health movement. Now, here is the summary. The summary is that we used to believe that in order to do something for kids with autism, we need to somehow find a germ, use an antibiotic and kill the infection. But the fact is that what we can do is focus on early identification and early intervention so that we can optimize outcomes. Were we to be able to do that, we basically would provide for a very different world for the next generations of children with autism. And our goal is not to cure autism. Autism is a way of being uniquely human in this on Earth. Our goal is to ensure that these children are affording what they need to fulfill their promise, so that they don't have those burdens that we discussed. And the idea is that we might be able to change the narrative of autism from one of disability to one of diversity. Thank you very much. Okay.
I love that part about
behavior is on the tied to genetic
disability to diversity, and changing the narrative. I think it's so critical. So, you know, again, as we start to shift into giving you more and more interventions in this particular area, right? I mean, there's good news, bad news, right? The good news is that we are developing and creating programs to be more individualized for the needs of our students. The bad news is that we are developing and creating those programs literally as we exist to be more individualized for the needs of our students. We don't have all of it figured out yet. We are in a really exciting time in this particular conversation, in this space with autism. But you may have heard the phrase, if you've been around the autism community for a while, this idea of, if you've met one person with autism, you've met one person with autism. And I think it's really so true, perhaps unique, you know, to autism, that it is so heterogeneous that it requires personalized evidence-based assessments that are accessible for the families and for the individuals. I think that's the work that we're doing. So in that Lancet Commission report, they lay out the approach. I mean, these are not my ideas. I'm sharing them, I'm amplifying them for all of you. But that approach is the idea of this personalized treatment plan. We're going to talk so much more in the near future about strengths, about changes in the context, about expectations across the lifespan. The idea that nobody should be waiting months to start treatment. Quite often we were, you know, waiting for diagnosis and then, you know, a comprehensive assessment. And there was a conversation about the limited resources to get those comprehensive assessments. And so families and individuals were waiting. Now, I think we've got enough research that suggests that beginning interventions, you know, will be more important than waiting on those assessments. And as I mentioned once before, it's really this key idea of what interventions work for whom, when, with what general outcomes, and then obviously at what cost. And these are the things that we're going to be talking with governments and service providers around. In particularly, right, including those who are minimally verbal, girls, women, minority ethnic groups, disadvantaged groups, those with severe co-occurring conditions. There's so much going on in this particular area of study. In the interest of time, I'm not going to show this video. It was the second video I have, but again, it's hyperlinked. You can watch it on your own. It's just some other really brilliant people talking about the system-wide problem that needs to focus on outcomes and greater empowerment within the individual and the family. Let's see if I can skip that. Because in the Lancet Commission, there's some really terrific guides or handouts, or this would be a flow chart, right? For us as practitioners, right? So this is brand new. I'm not expecting anybody to see it unless you have seen it or read it or know about the Lancet Commission. Put that in the chat box too. I would love to see that kind of feedback. But it's the idea that we're going to, you know, list all the relevant conditions that are going to require service. That we're going to look at individual factors, family factors. We're going to consider all of those factors, and then we're going to have conversations about accessibility, cost, you know, where we begin with some of these things and the methods. This is, I think, the framework and the guide for you as practitioners to talk about a personalized health approach. The things that we are doing at an early stage are not going to be the same ones that we're doing at adolescents, and not the same ones that we're going to be talking about with young adults. In fact, what we might be looking at with a personalized health approach is multiple treatment goals. I mean, these longitudinal studies are saying that when you start looking at the severity and connectedness with peers, mental health, you really are going to have to step up certain interventions or step down certain interventions, whether it be the intensity or the particular approach. I think, data-informed progress monitoring is really exciting work. It's conversations. It comes from, areas of school psychology that I think are beginning to infuse this whole area. And this was the best sort of chart that I had seen that sort of describes it. And again, in the Lancet report, if you can see it, right, gives you a link to the types of interventions that maybe we would be considering, that at preschool age, these are some of the evidence-based approaches that we would use for the family or for the child or for the community. And you can see that early stages were really focused on family. The child is at the center of it, but the family is getting so much of that help, right? Maybe the community has certainly an important role. But then as you begin to go to the school-aged population, the school becomes the major provider of the services. You start to see the child circle grow. Then when you get to adolescence, you can see how the adolescent takes a larger role than maybe the family does, right? It's sort of shifting not only what we know works, but also probably the area of these stepped up or stepped down interventions, ultimately to the adult, where the community is going to take a major role in supporting those who are at a certain age. I love this framework. I love that it gives a couple, ideas in here. If you can see what I'm seeing, there's ideas about sports and school inclusion. I mean, there's some really exciting things to digest from the Lancet report, but it is conceptualizing this idea that we're not just going to look at autism in some linear, singular, focus, but the clinicians really have to avoid, I said this already about that example from the classroom, putting all the maladaptive behaviors into the term autism. And certainly on the other hand, not neglecting the account, the role that core aspect of autism is, but this recognition that, individuals with autism are, complex and unique, and that we've got to think about them in those types of ways. So if you caught me saying, like, we don't have all of the answers yet, we don't have a manual that I can hand you, we're never going to have a manual that says, oh, do this first, do this second, right? I mean, it's going to be this personalized approach. What the field is thinking is that we're going to have to take current approaches to the work we do and make them more autism informed, make them more autism friendly, modify them based on what you know about autism, about the work that you do engaging with families and parents, and using their voice to, generate these modified approaches. I think it's so exciting to talk about the work we're doing and making it autism friendly, taking schools or businesses, taking approaches to anxiety disorders with cognitive behavioral therapy and making them autism friendly or autism informed, because that's the best thinking we've got today, is that you take evidence-based practice and you tweak it, you modify it, right? This is essentially what autism experts are telling us that we can do. I started thinking, I was looking for answers, and I think some of those answers are do the things you're doing, but become more informed in autism. And by being an attendee here, you're certainly doing that. So sometimes I get the question at this point, right? Like, okay, great, you got me, I'm sold, I love it. How do I do that, right? And that's why I had said I hyperlinked so much of this presentation. So one of the first spots I would tell you if you're working with younger children is the Autism Navigator. Let me know if this is new to you or if you've heard about it. The Autism Navigator has been around for a little while. It comes out of the University of Florida and a project that they had started called First Signs, where they were using video clips of very young children and then using those video clips to compare to individuals who would not be diagnosed with autism. And I was able to use some of the video glossary to work with elementary school kids, middle school kids, high school kids, to begin to recognize the signs of autism, to recognize behaviors when you can kind of see side by side typical development and maybe the development that looks more like an individual who gets diagnosed with autism. So this video glossary is amazing. amazing. There's so much information on there. Now, there are some paid webinars, but really there's also a ton of free information. And if you're looking for how do I get started with learning more about autism and recognizing the signs, this Autism Navigator is such a terrific way. When we talk about teaching students with autism around a variety of topics, and this is really for professional development, I'm going to click on the link and I think you guys should be able to see what I'm seeing, but this comes out of Southern Connecticut, and Fred Volkmer and others through several grants, I think, put this whole thing together. But what I really want you to see is that there are materials here for parents and caregivers, teachers, school staff, and look at the topics, right? Introduction to learning, reinforcements, collaboration, communication, transition through the lifespan, prompting, I mean, visual strategies and supports, challenging behavior. And each of these are, I think it said, well, it's a 20-part professional development series that is all free. So you click on it, link to it, learn more about autism. My daughter is in Ohio at The Ohio State University, so I would be remiss if I didn't talk about some of the exciting work coming out of Ohio, the state of Ohio, through Ocali. Let me know if this is a new resource for you as well, but there is essentially, this is the one I really wanted to show and it's hyperlinked, but there's a grab and go resource gallery of interventions. If you want to know about social stories, if you want to know about using video, if you want to know about embedded schedules, hopefully some of these terms are familiar to many of you, but if you want to do a deeper dive, you want to see what other people are doing, you want to get a real clear example of what this looks like. This Autism Center Resource Gallery is one of the best I've ever seen, totally free. You just click the link, it'll take you over there, and it really is, it's grab and go, which is such a great term for this. When we talk about mental health, the resources that you find related specifically to autism and mental health are a little more challenging to find. I think the National Autistic Society actually has some of the best materials I've seen out there. Many of them are written by individuals on the spectrum. So there's a lot of advice, guidance around the topic of mental health, some videos, some articles to read. They're doing some great work. They're actually in the UK, I believe. But I would also tell you, turn to your colleagues, right? As a school psychologist, I feel like I've got such a wonderful array of colleagues that I can work with who are here to help. Somebody who posts a lot in our school psychology community is Lee Wilkinson. He's created a couple books on best practices in autism. Again, it's hyperlinked in here. A dear friend of mine, Amy Canova, who her and I talk a lot about autism because she's a practitioner working with autism. She gave me this and said I could share it with you. It's hyperlinked if you want more, but she's taken the zones of regulation, which many of you in schools might be familiar with, and she's translated it for individuals with autism, specifically using the student's language. So for many of these are examples of what the student told her to use as far as strategies to go from the blue zone to the green zone to the yellow zone, and really connecting, I think, a lot of those emotion words, which I love doing. Not to mention the whole visual around this is really stellar. And with technology, we can do, some really fun things we can create. If you guys are looking for an evidence-based program, the PEERS program out of UCLA is amazing. I've hyperlinked not only to the program, but if you can see, these are actually YouTube videos. This is just a small sample of the myriad of free YouTube videos that are out there. The way I've been using them is I will work with an individual, I will show the video, and then we'll have a conversation, because the videos are terrific and they cover all, it's a checklist of, of all the important behaviors I would want. But sometimes you really have to translate them for the student that you're working with. Sometimes you really have to highlight or help the individual see the important aspects of each of those videos. But look at it. I mean, electronic communication, that comes up daily with teenagers and high school students. Appropriate use of humor, how to handle arguments. The videos are really great, all free. When we talk about video-based interventions, I actually think that this is huge. I think this is going to be the future of how we're really doing a lot of this work. But troublingly, that's a difficult word to say, there is some clinical reviews carried out by over 100 of these sort of interventions using video-based modeling that are saying, we actually don't know how effective they are, right, on progression of the child. And the research is not quite there. So as much as I get excited about video-based interventions, I just wanted to sort of make that another reminder of how in this area of autism, we've got some exciting, direction, but we're still building the platform for this. For anybody who's, working in this space, right? Language, communication, words matter. That same individual at another time gave me this quote about, I said, what do you love about reading? He had said, there are entire worlds within those words. And that was such a beautiful, poetic way of what words do for many of us, right? How much it matters. And when you start thinking about the neurodiverse mind, right, sometimes it can be very concrete in the way that they're thinking of. A word means something very specific. You can't use that word in all contexts. So I find that when you break down abstractions, when you're using visuals like we're talking about, when you watch out for dense questions, like a question, but it actually has multiple meanings, idiomatic language, right? All these things will confuse the individual with autism, or the teacher or the classroom when we talk about this. So I really like to talk about translating autism when you roll up your sleeves and you do this work. Here's an amazing example of somebody I was working with in my private practice who stopped driving his car in the winter months because he was fearful of getting into an accident and not knowing what to do, being arrested by the police if he had gotten into an accident. And so when we realized that, when we translated his anxiety, his mother helped create this script that he folded up, put in the glove compartment of his car, and reassured him, reduced his anxiety that if something were to go wrong, he could access his mom simply by opening the glove box, reading step by step what to do in the event of a car accident. All he needed was us to review this document, put it in the glove box of his car, and he began driving again. And I think that's a great example of we could say, well, he was driving and now he's not driving. Maybe it's his autism, but no, it was more about this anxiety that he had experienced. And once we were able to move past that anxiety, this is something that would be reassuring to any young driver. We were able to move past it very quickly and get him driving in a car again. Okay, I'm definitely out of time. I tried to give you some of the really exciting highlights and give color and flavor to it, but there's so much more that can be said. As I mentioned, everything is hyperlinked. I know I said at some point that I do a lot of work with Autism Speaks. They actually have an autism response team. So if you have questions and you can't access me or George or John or anybody else or your colleagues or the PowerPoint, call the autism response team, because I think they will be able to answer your questions. And you can see the types of questions that they get. This is hyperlinked to the work that they do. In the interest of time, I won't go over sort of this idea that we are expanding services, our population is growing, but really what I want to leave you on is the idea that when we value autism and neurodiversity, this is something that is going to benefit our entire society. So honor all the behavior that you see, stay curious about it, and please, please share the successes that you see. As a prompt and a social story, right? It's appropriate for you to clap as loud as you possibly can, cheer so that others in the room get jealous of what just happened here. I know I can't hear you, but that is my wish for you today.
Outstanding, Peter, as usual. And I know that you could not see the chat box, but as you were asking people, is this new to you, and asking for that feedback, lots of folks were posting in there, new to me, new to me, new to me. So great. I think you've hit a home run with kind of introducing many resources for our audience today. I think we have time maybe for a quick question that did come through to me. You spoke about the Lancet article and some of the model that is really coming out of some of the work there. And it really was fascinating. So you talked about kind of developmentally, how different supports or different aspects of the individual's life becomes more important. From a school's perspective, can you share how that might translate into what does it look like in the school for young children and for adolescents?
Yeah, there's an example that I will use when I get asked that question, which trying to think of a good behavior to share, but let me give it conceptually of the idea that when kids are in elementary school, certain behavior is cute, right? So if a kid runs up and hugs an adult on their leg, right, in elementary school, that's really cute and adorable. When you get to middle school, running up to someone and hugging them, right, if it was an adult or if it was a peer, becomes a little less appropriate. When you're in high school, it becomes even less. And when you're an adult, you don't have permission to walk into a store and hug someone because you're excited about something. And so I think what ends up happening developmentally, and I hope this is a good example, is that in those early stages, we can't just think about their development in the elementary school or in the middle school. We actually have to think 1 or 2 steps ahead developmentally, such that you say, is this something that will be important as a life skill? One of the other examples that Peter Gerhardt, another colleague, gives is if you've ever been in the checkout line of a supermarket, right? It really doesn't matter if you are stimming or you're talking to yourself or you have any odd behaviors. But when you have to swipe your debit card and put in your PIN code, God help everyone if you don't do that quickly, right? And so sometimes we really have to think about the practical behaviors and not worry about the ones that we think are disruptive, because it's inconvenient. I think we really have to start thinking ahead, this sort of developmental approach. I hope that answers the question, John.
No, I do, Peter. Thank you for that. And I love the example they just gave there. And I think it's critical for our audience to really think about that, because we sometimes do get caught up in the more dramatic behaviors or ones that appear to be disruptive when working with the autism population. And the reality is a lot of times it's just helping them to navigate their world and helping our world to navigate their world.
Perfectly said, John. Yes.
Yeah. All right. Well, listen, we could probably go on for another hour at least, kind of talking about this. But suffice it to say, Peter, thank you for
welcome.
everything that you have shared tonight. The chat box is filled with thank yous, glowing about the work that you've done. Just a quick reminder to the audience. You will get copy of these slides, as well as you'll have access to this webinar on demand. I know some of the folks are kind of saying, I'd love to show this to my staff. I'd love for my teachers to be able to take a look at this. And so anyone who registers for the webinar series will have access to it.
Hey, John, we've got a point of clarification here. This is my mistake. Todd Savage, our next week's webinar, he's coming on February 9th and doing this webinar. Next week is Ben Fernandez. I think we might have the next slide. Oh, no, we don't have it in there.
Not a problem, George. I think I mentioned at the very beginning, yes, Ben Fernandez, Dr. Ben Fernandez is going to be with us next week talking about best practices in crisis response in the schools. Definitely encourage you to join us for that webinar. Ben is a nationally recognized expert within this area, has consulted with school districts across the nation, internationally really, in helping them develop crisis response prevention as well as crisis response plans. So we invite you to join us back next Wednesday at 5 p.m. Eastern Time for Ben Fernandez. And as you saw, for our final one, Dr. Todd Savage will be with us in a couple of weeks. So let me turn it back to my friend, George.
Yes, thank you, John. Thank you, Peter. What a wonderful webinar. I wrote down about 4 or 5 questions that, of course, we couldn't get to, but I am anxious to learn more, having done a bit of autism research on my own path. With that, we'd love to thank all of you for coming. If you'd like more information about Illuma, I would be remiss to not remind you to come check us out at illumatherapy.com. And as always, follow us on Twitter. We're doing all kinds of exciting things with the likes of Dr. Kelly, Dr. Faustino, and many, many others that are helping us learn more about the world and the students we serve. So thank you all for coming, and we will see you all next Wednesday. Thank you.
Thank you, George.